In this short video, we will be discussing opioid overdose and naloxone, how to administer the life-saving drug. This presentation was compiled by the American Medical Women's Association Opioid Addiction in Women Task Force. Listed here are the people that were involved in making this presentation. The opioid crisis in the United States has led to an overall increase in deaths associated with opioid overdoses. The CDC reports that 136 Americans die every day from an opioid overdose. 2 out of 3 opioid-involved overdose deaths involve fentanyl, a synthetic opioid. Other opioid examples include natural opioids such as morphine, codeine, and heroin. Tramadol is another type of synthetic opioid, and oxycodone is a semi-synthetic opioid. A record number of Americans are dying of drug overdoses, with more than 71,000 in 2019 alone, a majority of which involved a prescription or illicit opioid. However, not all overdoses have to end in death. We can all play a role in preventing opioid overdose deaths. The best way to start is by learning about the risks of opioids and about the medication Naloxone that reverses the effects of opioids. It is also important to be able to identify the signs and symptoms of opioid overdose. If you come across someone you think might be overdosing from opioids, look for the following: slow or absent breathing, lack of movement, gurgling sounds or snoring, skin that is cold and clammy, blue lips and nails, choking, inability to be woken up, and tiny pupils. If you identify someone you think is overdosing from opioids, follow these steps. First, call 911. Describe the state of the person like not breathing, turning blue, or unresponsive. Then, try waking the person by shaking their shoulders and calling their name loudly. If this does not work, perform a sternal rub by rubbing their breastbone with your knuckles using a closed fist. If available, give naloxone. Monitor their response, including breathing, giving rescue breaths if needed, and chest compressions if you cannot feel a pulse. Repeat naloxone administration if you see no response after 3 minutes. A good rule of thumb is if you see someone who is unconscious, assume an opioid overdose and treat with naloxone if available. Naloxone, also known as Narcan or Evzio, works by blocking the effects of opioids. It comes in 2 forms: an autoinjector that can be injected into the thigh and a nasal spray. Remember, if you suspect an opioid overdose, administer naloxone, even if you aren't sure. To use the naloxone autoinjector, begin by removing it from its outer packaging. Next, pull off the red safety guard. Place the black part of the device against the person's thigh on top of their clothing. Press down firmly and hold for 5 seconds. The autoinjector contains only 1 dose of medication. To use the naloxone nasal spray, begin by removing the device from the plastic packaging. Place your thumb on the bottom of the plunger with 2 fingers on the nozzle of the dispenser. Next, place the nozzle into the person's nostril. Push the plunger to release the dose of naloxone into the nose. Like the autoinjector, the nasal spray contains only 1 dose of medication. After administering naloxone, stay with the person and continue to monitor their condition. The medication should begin to work within 5 minutes. However, after 3 minutes, if there's no response or only a minimal response, give another dose. Be careful, naloxone can wear off. If the person stops responding, give another dose of naloxone using a new nasal spray or autoinjector. Naloxone may be given every 3 minutes. Because naloxone blocks the effects of opioids, it can lead to withdrawal in someone who is dependent on opioids. Withdrawal symptoms can include sweating, diarrhea, fever, nausea, vomiting, and trembling. While these symptoms can be frightening to see, they are usually not life-threatening. Risk of withdrawal symptoms is not a reason to not administer naloxone. There is limited data available on the use of naloxone in pregnant women. This is an area of active research and more information is still needed. It is known that naloxone can cross the placenta and cause withdrawal in the fetus as well as the mother. Naloxone use in pregnant women requires careful monitoring of the mother and fetus. In children, naloxone has been found to be safe for treating opioid-related breathing problems. However, this is an area that requires more research on the long-term effects of naloxone. It is important that anyone who has overdosed while using opioids is evaluated in the emergency room. Even if the person is awake, alert, and says they feel fine, encourage them to seek medical attention. Patients should be monitored for 2 hours after the last dose of naloxone to ensure that symptoms of overdose have resolved completely. If you are interested in having naloxone on hand in case of an overdose, there are a few ways to obtain either the autoinjector or the nasal spray. First, you can go to your local pharmacy. All states authorize state-licensed pharmacists to dispense naloxone to any individual. You do not need a prescription. You can also ask your primary care physician, the local health department, or it may be obtained through various overdose prevention groups. If possible, request 2 packages, since each device contains only 1 dose of medication. Once you obtain your naloxone, remember to store it at room temperature and away from direct sunlight. If you do not remember how to use the device, review the directions on the packaging. It is a good idea to obtain naloxone if you fall into either of the following categories. You are taking chronic opioids, or you have a family member or friend who uses opioids. It is important to remember that naloxone is not harmful, so give it when you suspect an overdose, even if you aren't sure. It could save someone's life. And remember, naloxone is not a substitute for medical care. Call 911 when you suspect an overdose and encourage the person to seek care, even if they say they feel fine. The risks provided in this presentation are not comprehensive. To learn more, talk about naloxone with your healthcare provider. The information contained in this video is intended for educational purposes only and should not be substituted for medical advice from a doctor or healthcare provider. Thank you so much for your attention. We hope this video provided you with some basic information about naloxone, how to obtain it, and how to use it if you suspect an overdose. For more information, please check out the resources provided here.